Welcome to this DVD outlining early intervention services in Canterbury. Each of Canterbury's 4 early intervention service providers receives government funding. Together they are represented by the Early Intervention Coordination Service, which exists to ensure that your child receives the best care. We provide a streamlined referral and assessment process for infants and children with intervention needs. Each referral is followed up to make sure that families are connected to an early intervention provider most suited to them. It is intended that children do not fall through the cracks and miss out on early intervention. This DVD will help to give you information about the full range of services available to assist you make a choice of provider most suited to the special developmental needs of your child and family circumstances.
CCS Disability Action believes that all children should have the opportunity to develop to their full potential. We believe that the family home provides the best setting for therapy, and our teams build programs that are based on the everyday things your child does in their daily lives. As children grow, we grow with them, and you'll find our team at work in early childhood centres, where additional support can be provided by our teacher aid program if necessary. Each level of development is matched with visits from therapists with skills appropriate to your child's age and stage. Our team will provide for your child's therapeutic and educational needs during all their preschool years. We have particular expertise with infants born prematurely and in general with babies under 1. We ensure that caseload numbers are limited so that our team have sufficient time and resources to provide an optimum level of service for your child. As far as possible, we organise our visits to fit in with each family's timetable, and we can be flexible if circumstances change. Our programs are well coordinated, and parents guide us on what is the most important focus and goal for their child.
The Champion Centre provides services to infants and children who have both health and educational difficulties that affect multiple aspects of their development. We have particular experience working with children with Down syndrome and children born prematurely, but we also work with children with a range of other developmental challenges, including cerebral palsy, general developmental delay, and autistic spectrum disorder. Families come to our centre weekly or fortnightly during school terms. At each visit, our teams of therapists work with you and your child, helping you learn how best to support your child to reach their highest potential. In addition to our core therapies, we also offer music and play specialists, computer-based learning specialists, and feeding specialists. All families also have access to a social worker, an education support worker, and a psychologist. The aim of our service is to walk alongside you and your family from birth or diagnosis through to the time your child starts school. And when it is time to move on, we support you through that transition.
The Special Education section of the Ministry of Education and Beacon House Children's Therapy team of the Canterbury District Health Board work together with families. We aim to support parents and caregivers to help their children achieve their full potential throughout all stages of their development. Our highly skilled team has a long history of working with children who have a variety of developmental needs. We offer a full range of therapies, including kaitaka waianga support for Māori families. Children are seen in a variety of settings: home, early childhood centres, or at one of our clinics. Interpreters and community support workers are used for families who do not have English as their first language. Following assessment, an individual plan is agreed with the family and early childhood centre. Interventions are based on play and everyday activities. We work with parents and teachers to ensure that all our therapies take into account the specific requirements of the child and their abilities.
I got my hair cut the other day. Don't I look absolutely beautiful?
Conductive Education Canterbury provides a program for children who have a physical disability or developmental delay due to a motor disorder. Working with children from 6 months through to primary school age from our centre at Addington Primary School, we offer your child up to 3 sessions per week. All our programs are offered in a small group setting with other children of a similar age and stage. Programs are adapted to meet the needs of each child. We also offer weekly horse riding and swimming at the Burwood Hydrotherapy Pool. Our specialists are called conductors. They are specifically trained to work with people with motor disorders such as cerebral palsy. The conductor works alongside the early intervention teacher and in collaboration with other specialists according to your child's specific needs. Our environment is happy, caring and supportive. Many parents gain new friendships and support as they meet other families who are in a similar situation.
Your child will be referred to the Early Intervention Coordination Service by a paediatrician. The service meets regularly to assess all new referrals, monitor the number of spaces available with each service, and maintain a waiting list if necessary. Each of the providers is represented at the meeting, and members of our team have different professional expertise so that your child's needs are able to be established.
The types of children that are referred to early intervention are those that fall into a group of brain developmental problems, those with genetic chromosomal problems, which we know are associated with multiple areas of delay, and the very, very preterm babies who often have a lot of associated problems with their breathing and their feeding. I think the best part about early intervention is the team approach, the combined wisdom of a number of health professionals and educational professionals that really support and help the child achieve to the best that they can.
Once your child's referral has been discussed by the group, you will receive a letter from us telling you which services are able to meet your child's needs and the possible waiting time for a place. We do our very best to keep waiting times under 2 months. You will be asked to indicate your acceptance of a place as soon as possible. It is important that you do this so as not to delay your child's access to service. Once a decision on the service provider has been made, the provider will make contact to arrange a visit. Some families immediately establish a relationship with the specialists working with the child. For others, it may take longer. It is important that you give this process time. If you find that you are unhappy with any aspect of your child's program, please talk to a staff member about this. Some families may choose to change services. Please discuss this with your provider. If you have any questions about the process or any other aspect of early intervention, please talk to the Early Intervention Coordinator. Contact details are available from your paediatrician. It's important to all of us that your child gets the very best care.